Hello, my name is Dr. Todd Jackson. I'm so grateful that you're here today at Mojave Eye Center, and I'm excited for the opportunity to meet and talk with you. Thank you for taking the time to listen to and watch this video. In this video, I'm going to talk to you about what a cataract is, how it's treated, what are the risks, benefits, and alternatives to the procedure, in addition to some of the advanced technologies. That way, when you and I sit down, we have an opportunity to address your specific questions. Okay? So adjust the volume so you can hear me appropriately. You can expand the picture if you're not able to see properly. You can pause at any time. Also, if you want to take out a pencil and paper, maybe there's questions that you want to jot down that we can go over when we're together. All right? First of all, let's start off with what a cataract is. So if this is the eye itself, you've been seen by your eye care professional and they've diagnosed you with a visually significant cataract. Hence, that's why you're here talking with me. My goal is, number one, examine you and make sure that I agree that it is the cataract that is causing an impairment of your vision. And if it is, then we talk together about how do we cure that for you. This is the eye. This would be the corneal surface, then iris, retina, and optic nerve, iris, retina, and optic nerve. Behind the iris, which is the color part of your eye, is an intraocular lens. Okay? When this intraocular lens becomes opacified or cloudy, that's what we call a cataract. Cataracts generally come in one of three flavors, I like to call them: chocolate, vanilla, strawberry. Chocolate being nucleus sclerosis, which is a yellowing of the lens. Vanilla being cortical spoking, which is the second most common, which is some spokes that happen in the lens. And strawberry being posterior subcapsular, which are small vacuoles or collections of cells on the posterior surface of that lens. Many individuals have a combination of nucleus sclerosis and cortical spoking, some with a little bit of PSC. Depending on your type of cataract and its maturity, it affects how your vision turns out, because light enters the eye through the cornea, and then that light is to focus onto the retina. The cataract, when it becomes opacified, that opacification causes that light to be dispersed and not to fall directly on the retina, hence causing blurry vision, glare, halos, particularly at night, which are the common symptoms of cataracts. Now, many individuals ask me, well, at what point do cataracts need to be removed? There are two criteria in order for cataracts to be removed. One is you got to have a cataract, and everyone will develop a cataract. Now, two is there needs to be symptoms. There are individuals who have very mature cataracts, yet don't have any symptoms, meaning they read fine, they see fine, their glasses work great. Now, that's an important point. The qualification for cataract surgery is vision that has been impaired even with your glasses. So there are individuals who come in and say, yeah, I'm having problems seeing street signs. And I'll ask them, well, how is it with your glasses? And they're like, oh, it's perfect. Well, in that particular case, they may have cataracts, but it may not be time for them to have cataract surgery because the symptoms are not severe enough. Most individuals do have symptoms that are severe enough. If you're one of those individuals that you really feel like your vision's pretty good and you're functioning well with your glasses, that may be an indication that we're going to get to wait a little bit to take out your cataract. Okay, so now that we've gone over what a cataract is, remembering that it is this intraocular lens, let's go over what the procedure is to take that cataract out. Here in Mojave County, we have some of the best equipment to take cataracts out. Allow me for a moment to do our model again. The procedure itself takes about 6 to 12 minutes, depending on the patient and type of cataract and maturity of the lens. There, you get some relaxation medicine. During the case, you won't feel pain, but you will feel pressure on and off. You'll see some amazing colors. After the procedure, you'll go home that day. I really don't want you to watch TV or read books just for that evening. You'll have a shield on. You'll be able to see that very same day. Your worst day of vision is your day after surgery. And then 90% of the improvement happens within the first week. Okay, every day you should notice improvement. Slowly get better and better. During the surgery itself, I give you medicine on the inside of the eye that both prevents infection and reduces inflammation, and also reduces your need for drops both prior and after for the vast majority of patients. There are some patients who will need drops, and that's unique to them. Let's talk about the risks, benefits, and alternatives after we talk about the procedure itself. During the procedure, make tiny little incisions within the cornea, which is this portion of the eye. Then go ahead and make a precision hole here where the lens is, remove the cataract, and then after the cataract is removed, a new lens is placed inside of that bag. And then the wounds are sealed up and you're ready to go. Let's talk about the risk. 97% of the time, everything goes well. 3% of the time, you can have complications, which can include bleeding, infection, pain, retinal detachment, retinal tear, high pressure in the eye, low pressure in the eye, stroke to the optic nerve, damage to the eyelids, or the need for further surgery, including exchanging of the lens. Now, if you're one of those 3% of patients who has complications, if those complications are identified and treated appropriately, the vast majority of those individuals will have good vision. It just takes them longer. Okay? Those are the risks. The benefit is to be able to see better, and the alternative is to do nothing. The vast majority of cases, almost never, is cataract surgery an emergent procedure. So the good thing is time is on your side. Those patients, your aftercare, most patients who do not have complications are seen by our optometrist. Now, if you do have complications, then I get to see you. And I'm available for you at any time, 24/7. Call the answering service and they'll contact one of our optometrists, and then ultimately it gets to me. You're going to be getting a cataract book today. In that book, I want you to read through it. I wrote that book along with my partner. It's written in such a way to kind of answer your questions, go over a lot of what we went over today. But at the end of that book is my cell phone number. So if you get, and I believe it's page 32, so if you get to page 32 and you still have questions, give me a call, please. I live here in Mojave County. I'm here to answer your questions and make sure that you get the best, highest quality procedure possible. All right, so now we've gone over the risks, benefits, and alternatives, and we know about what a cataract is. Now let's talk about some of the options that are available at the time of cataract surgery. This is very exciting because there are some wonderful technologies that help to make the procedure safer. There's also some technologies that help to enhance your lifestyle. Now, often my first question to you will be, do you want to wear glasses after the surgery? Actually, I'll phrase it such as, do you want to be less glasses dependent after surgery? Now, the reason why I ask that is because, remember this new lens that I'm sticking on the inside of the eye? Those individuals, if your answer to that question is, you know what, I would really, really love not to have to wear glasses for most activities after the surgery, if not at all. If that's your desire, there are some technologies and techniques that we can use. Okay. Unfortunately, insurance doesn't cover some of the technologies if you want to be less glasses dependent, but I'll go over them with you. So, one of the best options, and also the most affordable option, is what's called monovision, which means one of your eyes, usually your dominant eye, is set for distance, and your other eye is set for up close. So because this lens that goes in your eye it focuses the light from one distance. So, like I said before, dominant eye, light from distant objects gets focused, and your non-dominant eye, light from near objects gets focused onto the retina. Then, in that way, you're able to see distance and up close. Um, there's no extra charge for that. However, the caveat, the downside of that is, what about intermediate? Well, computer work. Well, you might need a pair of glasses for that. Also, 30% of individuals do not tolerate monovision, meaning they get one prescription one eye, another prescription the other eye, and they feel off center or off balance. Hence, monovision cataract surgery is best for those individuals who've had monovision before. Usually it's contact lenses. They've had one contact lens for up close, one contact lens for the distance. If that's you, monovision is a great option for you. Now, if you haven't had monovision in the past, there's another technology. It's called multifocal lenses. These lenses, advanced technology, they have concentric rings inside the lens itself. So it focuses light from distance, intermediate, and near. Now, those lenses are an additional cost, ranging several $1,000s for those lenses per eye. And that gives you the advantage of not having to find reading glasses for the vast majority of things. You're able to see the computer, you're able to see the distance. The downside with those multifocal lenses is if you're nearsighted people do not like those lenses. Okay? So I generally do not recommend them. The reason why they don't like the lenses is because the splitting of light reduces the clarity a bit, and they're just really not happy. If you're farsighted, um, those individuals really love these lenses. It's a home run. So it's kind of a long story, but getting back to the initial question, do you want to have glasses after surgery? Do you want to be less glasses dependent? If the answer is no, I like my glasses, golden. You don't even have to worry about monovision or the thousands of dollars of costs related to multifocal lenses. But if your answer is, you know what, I really would like to not have to reach for those computer glasses or up close glasses for most activities, then we have options for you. Now, you notice I've said less glasses dependency because there's no guarantee, even with the multifocal lenses, that you're not going to have to use glasses for some activities. In fact, in the FDA trials with the multifocal lenses, 95% of the time you could be without glasses, but 5% of the time you still needed to wear glasses. So I just wanted to make sure that you know that ahead of time. Those options and technologies are available to you here in Mojave County, some of the best eye care in the world. Okay, so back to that question number one. Do you want glasses? Do you want to be less glasses dependent, or do you mind wearing glasses after the surgery? If your answer is I don't mind wearing glasses after the surgery, great. We're going to calculate a lens to help you to see distance. 80% of the time, those individuals who've had cataract surgery, the lens will help them see distance. You don't even need to wear glasses for distance. But 20% of the time, you'll still need glasses for distance to sharpen things up. You're like, wait a second. I thought you're calculating everything. We do hundreds of thousands of measurements in order to calculate the power of the lens that's going to go inside that eye, right? So why isn't it 100% of individuals who are able to see 20/20 in the distance without glasses? And the answer to that question is this. Although all the measurements are calculated for you to see 20/20, if you have pathology, let's say you have diabetic retinopathy or glaucoma or age-related macular degeneration, no matter what I do up here, I'm going to help you to see better, but it's not going to be perfect because of the pathology back here. Think of an old camera, right? If the front of the camera is beautiful, but the film is busted, this picture still doesn't come out. Another reason why 20% of the individuals are going to need glasses to sharpen things up, even in the distance, has to do with how thick this is. Okay? In the human eye, the thickness of a lens is about 3 to 4 millimeters. The new acrylic foldable lens that's customized to your eye, that we're going to be putting in your eye, is less than a millimeter. So there can be some shift, either slightly forward or slightly back, inside of that bag, as that bag, because remember the bag stays behind, as that bag contracts onto that lens. Hence, that's why at least 20% of individuals are going to need a little correction to sharpen vision even for distance. Okay? So, just so that you know that, remember 97% of the time during the surgery, everything goes well. 80% of the time, all comers, the vision and the distance will be perfect and you won't need glasses. 20% of the time, you will need glasses to sharpen it up for the distance. Now let's talk about up close vision. Those individuals who do not do monovision or multifocal lenses, they will need glasses to read up close. That's on purpose, right? Because remember, in a standard cataract case, that lens is set for distance. So light coming from distance is focused onto retina. You will need reading glasses, okay? Unless you do monovision or multifocal lenses. All right, one last thing, astigmatism. Astigmatism is where the cornea, which is this part here, okay, is not perfectly round. So someone who has astigmatism, rather than the cornea being kind of like a basketball, it's kind of like a football, slightly oval. So astigmatism, if your goal is to be the least glasses dependent possible, astigmatism needs to be corrected or needs to be improved. Now, some astigmatism, 0.5, that's a measurement, 0.5 and above causes blur, doubling of vision, blurry vision. 0.5 and below is actually helpful astigmatism that gives you some depth of focus. So um, if you come in and we've already done your measurements today, or we'll be doing them shortly, if you have less than a half a diopter of astigmatism, we're going to leave it alone. You actually want that. If you have more than a half a diopter, there's some options to reduce your astigmatism, to kind of reduce that doubling and clear up the vision. So those individuals who want the best vision possible, you'll want to correct your astigmatism if it's over a half a diopter of corneal astigmatism. Now, many of you have heard from your optometrist, yeah, I've got astigmatism, we got to get it corrected. Chances are you do have astigmatism, but we need to measure the corneal astigmatism. Astigmatism can be in the lens and in the retina as well. And so what's in your glasses or your contact lenses is not exactly what I'm going to be correcting, because I'm taking out this lens and negating the astigmatism that's lenticular. So I'm worried about corneal astigmatism. You don't have to worry about any of that, but I will be showing you that to give you that option of, that very first question. Do you want to be less glasses dependent? And you say, I want to wear glasses. Then we don't have to worry about astigmatism correction, because you can have astigmatism correction done in glasses, right? But those of you who want the best vision possible with the least dependency on glasses, we want to address astigmatism. And we'll do that when we look at the measurements themselves. We get an idea from your glasses, we get an idea from your contact lenses. By the way, if you have your contact lenses in today, we're going to have to repeat your measurements, because if it's soft contact lens, you need to be out of those soft contact lenses for about 3 days prior to us taking measurements. And that's so your cornea can assume its normal curvature. We get the most accurate results. If you have hard contact lenses, you got to take it out a week for every decade of use. And you can talk to our surgery counselors or with me with regards to more questions about that. So back to astigmatism. If you have a little astigmatism, it's corrected with a limbal relaxing incision. That's utilizing a diamond blade that actually makes some precision cuts. It helps relax the cornea. If you have a lot of astigmatism, they're what called toric lenses. Remember that astigmatism correction is not covered by your insurance. So depending on the amount of astigmatism, either we're going to leave it alone, or you have a mild amount of astigmatism, which will be adjusted with what's called a limbal relaxing incision. It costs, has a price associated with that, or a lens-based astigmatism correction. If you have more than about a diopter and a half of astigmatism, we'd correct that with a toric lens. Okay? So now we've kind of gone over kind of the complex stuff. We talked about the risks, benefits, and alternatives. We talked about what is a cataract, how is it treated, what's the surgery like, 6 to 12-minute procedure, no pain, you're able to see that same day. You get 90% of improvement within the first week. We talked about how many of you are going to need glasses versus not, and why wouldn't you need glasses versus those who will need glasses, that touch up. Those individuals who don't do monovision or multifocal lenses, they will need to have reading glasses, almost all of them, okay? Some further advantages and benefits to you. We talked about dropless surgery. Many of your friends who've had cataract surgery, they've had to put in about 300 drops. Most of you will not have to put in any drops because we're putting the medicine in your eye at no additional cost to you. Also, some things that you don't normally hear about at your normal postoperative period, but the protective gel that goes into the eye. There's good, better, and best gel. We provide the best protective gel made by Alcon, Viscoat, and ProVisc for all of our patients at no additional cost to you. In addition, the lens that's going to be going to your eye, even the standard lens, the basic lens, even without an upgrade, those are very high quality lenses. It's top of the market. They're done in quarter diopter steps. There's almost no other surgical facility that provides dropless procedures, state-of-the-art, highest quality lens and quarter diopter steps, along with that protection of those, what they call viscoelastic agents. So those are all provided to you as a part of our service here. Also, for those of you who are online, have an email address, or a loved one who has an email address, we're going to get you paired into Health Loop, which we actively track how you're doing. And so if you have a problem or a question, you don't, in addition to our on-call service, you can also reach us via your mobile phone or email. And that's 24 hours a day, 7 days a week. If it's an emergency, certainly you would want to call our on-call number. Okay, so don't lose your cataract book. You want to bring that to every visit with you. All right, now we're going to talk about some technologies to help reduce your risk. Remember, we talked about that 3% risk. There's a 1 in a million chance that you could lose the eye completely. Okay, I specialize in complex cases. Most cases are not complex. I specialize in complex cases because of my work in Guatemala and in Africa and in the Navajo Nation and around the world. But I don't have to use those techniques on most of the patients here. But rest assured that if there is a problem, either we've seen it before or we know how to fix it. Okay. But a technology to help to reduce the risk of a complication has to do with Zepto-assisted cataract surgery. Many of you have probably heard about laser-assisted cataract surgery. Zepto-assisted cataract surgery is a technology that helps with one of the most critical steps. So there's two ways of doing cataract surgery. So we've got basic, which is covered by your insurance, and it's a high quality procedure. And then the other technique is basic plus Zepto enhancement. Now, what is Zepto? Zepto has to do with one of the most critical steps in the entire cataract surgery. Remember when I told you about making that hole here in the cataract so that I can get to the cataract and take it out? That hole in basic cataract surgery is made by me taking a forceps, grabbing the edge, and gently trying to peel a perfect circle with a forceps. The best, that's called a capsule rhexis, the best capsule rhexis needs to be a particular size, 5.2 millimeters. Needs to be as circular as possible because a circle is stronger than anything. And it needs to be in a particular location because you don't want this shifted up or down, because remember how we talked about that healing of that lens and the 20% of people are going to have some shift. Also, one of the most common complications in cataract surgery is that circle that I tore can then tear out. Okay? So to help eliminate that, they developed a technology called Zepto-assisted. And Zepto-assisted is essentially a 5.2 millimeter perfectly circular silicone ring that's attached to the Zepto machine. That silicone ring is gently put inside the eye. It's placed exactly where we want it to be placed. And within a half a millisecond, a pulse of energy gently sculpts a perfect circle. Now, the advantage of that Zepto is when it sculpts that perfect circle, it seals the edge, making it 4 times stronger than one that I tear by hand. So that complication of it tearing out and causing the lens to go into the back of the eye, which can cause a retinal detachment and the need for another surgery, is reduced by about 50%. Zepto-assisted cataract surgery is twice as strong, according to the studies that have been published than laser-assisted cataract surgery. And it's 1/3 the price of laser-assisted cataract surgery. So essentially, in Zepto augmented cataract surgery, it's the same as the basic, except for that one step. And that Zepto device helps us to make a perfect circle in the perfect spot with a reinforced strength to that edge. Now, does Zepto assisted cataract surgery help you have better vision than the basic? No, it doesn't. There's not evidence that shows that. There is some evidence that shows that we get more consistent results. But what you're paying for in Zepto assisted cataract surgery is the reduction of risk of complications of retinal detachments, retinal tears, surprises during the surgery itself. Zepto is available to almost every patient, with some exceptions. It's an additional $500 per eye for the Zepto assisted device. It's a single use device, so we have to throw it away after each eye. So hence, each time we use the Zepto device, there's a charge associated with that. For those individuals who'd like to do basic surgery with Zepto augmentation, that's available. Zepto, if you opt to do any of the astigmatism corrections or multifocal lenses, Zepto is included inside of those packages, so there's no additional charge for those. But that's available to the patients, and we also have payment programs. I believe it's 1 year, no interest for those Zepto enhancements or any of the other enhancements that you desire. Okay? I hope this was helpful for you. Now, one last thing that we need to talk about, one of the questions that patients have is the cataract going to come back? And the short answer is no, but the long answer is yes. Okay, what do I mean by that? The primary cataract that I took out will never come back, but this capsule here will become cloudy over time. And about 80% of people will need a one-time laser cleaning that's covered by your insurance. At some point, the vision may get a little cloudy. You talk to your optometrist about that. They will see that you have what's called an after cataract or secondary cataract. Also, remember how we talked about those 3 types of cataracts right at the beginning: nuclear sclerosis, cortical spoking, or posterior subcapsular, chocolate, vanilla, strawberry. That strawberry type actually has a high predisposition for secondary cataracts. If that's the case and we need to do that laser adjustment for you, that can be done when it becomes problematic, usually after 3 months. Some individuals don't need that laser cleaning for years or decades after the surgery. With that, please, once again, read through your book. If if you are signed up for Health Loop, you'll know about that afterwards. Please check those updates because we want to actively monitor and make sure you have great results. And if you have any questions, please feel free to call me. My personal cell phone number is in that book. If you can't reach me on that, use the on-call service. We want to be able to make sure that you have the best procedure and best experience possible at Mojave Eye Center. If you're in Lake Havasu, Bullhead City, Laughlin, Kingman, or the surrounding areas, please contact us at any time. We are happy to help and serve you. With that, look forward to seeing you and answering any of your further questions. Thank you.